Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
Hi, I'm Hera. I'm one of the Deputy Lead Audiologists at Great Ormond Street Hospital. We do a multitude of different things. We test hearing from the ages of 0 to 18. We'll diagnose hearing problems. We will fit devices which include hearing aids, cochlear implants, bone-anchored devices. We'll also provide auditory processing disorder test batteries and management strategies. Other than that, we will see complex children who otherwise may not necessarily be able to perform a behavioural assessment, so we'll often get complex caseloads here at Great Ormond Street. We also support the main site in lots of different ways. So we're the largest oncology site where we will test children who are currently undergoing treatment via chemotherapy or radiotherapy. We also see children who are under their cleft audits or craniofacial audits. We'll also support the hospital on the wards if anybody requests a hearing assessment for any types of medication that they've been on that might affect the hearing. It can be a little bit stressful, so we try to do whatever we can to ensure that the children and the families are as comfortable as possible. My route into audiology was via a 4-year degree at UCL, after which I worked for a few years in a few different places. I took some time out and then have been at Great Ormond Street for about sort of 9 years now, I believe. So today we're going to be filming a procedure called an auditory brainstem response, and it's usually shortened to ABR. That will involve us testing a baby who is going to be asleep, in a deep sleep, and we're going to be putting some sticky pads on the forehead and behind each ear, which will record a hearing response from the back of the brain. We will put some sounds in the ear through a little spongy tip, and that will make a sound that we hope the baby will be able to hear. We'll record that, and then we will discuss the results with you and talk about what the next steps are. The test that we are doing at the moment is called an auditory brainstem response test, or ABR. For this test, it's really important that we try to have your baby in a deep sleep. In order to do that, what we recommend is if you try not to feed your baby and try to keep them awake until they get to the hospital. We understand that can be quite difficult because babies may sleep on the way, but just try your best, and if not, we will try to see if the baby will fall asleep when you get to the hospital. What we will do is prepare your baby's skin with a special slightly abrasive gel that will help to clean the baby's skin on the forehead and behind the ear, on the bony part behind the ear. After that, we will put some special sensors on those places where we've cleaned. That will help to pick up the recording that we are looking for from the back of the brain. We will check your baby's ears, making sure there is no wax or obstruction that might block the ear up. If it is clear, we will put a spongy tip in the ear which will make a sound, but if it is blocked, don't worry, we can use something called a headphone which will cover the ear. Once we have prepared your baby's skin and put the spongy tip in the ears, we just need to wait for your baby to go to sleep. Once your baby is in a deep sleep, we'll be able to start testing. This can take some time, so just relax. Once the baby is asleep, we will start recording, which is where we put in the sound in the ears. What we're looking for is a waveform which tells us that we are picking up a response from the back of the brain, which is called the brainstem. If your child wakes up in the middle of the testing, that's okay. It happens all the time. We just will try to wait until we go back to sleep. And if we don't, we will try to book you another appointment. The testing, whether it is under natural sleep, sedation, or general anaesthetic, is completely painless. It just involves your child going to sleep and us putting sticky pads on their heads. The testing can take a long time, so it can take an hour and a half, especially if the baby wakes up and then goes to sleep. That can be a little nerve-wracking for some parents, but please don't worry. It's just something that can take some time.